Image-based questions you can't skip for NEET PG 2025 for biochemistry. Let's start. Starting with alkaptonuria, also known as black urine disease, where urine turns black on long standing, like this picture. Then there is a deficiency or defect of homogentisate oxidase enzyme. The patient might suffer from like bluish black discoloration, or known as ochronosis, or due to alkapton bodies accumulation in the skin, like this picture. Patient ferric chloride test positive, Benedict's test positive. Second comes xeroderma pigmentosa. A picture shows like this. Then there is a defective DNA repair for nucleotide excision repair defect, sunburns, frequent sunburns, freckling of the skin, photosensitivity can be seen here. Then comes von Gerkes disease. It is babies coming with hepatomegaly, poor growth, muscle weakness, seizures. Patient might have hypoglycemia, lactic acidosis, hyperuricemia. This is glycogen storage disease type 1 due to deficiency of glucose 6 phosphatase enzyme, and there may be deposition of glycogen in the liver and kidneys, and the picture looks like this. Third, McArdle's disease. This is a glycogen storage disease type 5. The patient have sudden onset cramps and the muscles, exercise intolerance. The patient there is a defect in the PYGM gene, and muscle glycogen phosphorylase deficiency. The patient have this kind of muscle biopsy picture. Tay-Sachs disease. In the Tay-Sachs disease, there is a hexa gene mutation, cherry red spot in the macula. You can see like this. Then there is a GM2 accumulation in the gangliosides, macrocephaly, hypotonia, mental and motor delay, and convulsions can be seen here. Next comes acrodermatitis enteropathica. Very important picture, looks like this. Then there is a genetic disorder where there is a less absorption of zinc. The patient have dermatitis in form of blistering, inflammation, diarrhea, hair loss, nail issues. Mostly babies, rash in the anal area or the oral area, looks like this picture. And Farber, next comes Farber disease. In the Farber disease, there is a lysosomal storage disease due to mutation in the ASAH1 gene. There are symptoms like subcutaneous nodules on the joint or joint spaces or pressure points. There is a painful joint contracture. There is hoarseness of voice or aphonia. There is an enzyme defect of acid ceramidase, and the picture looks like this. Hurler's disease. This is mucopolysaccharidosis 1 due to defect of alpha L iodinidase enzyme. The patients have coarse facial features, intellectual disability, short stature, claw-like hands, and corneal clouding is very important. Corneal clouding. Then hepatomegaly in cases of Hurler disease, and the picture looks like this. Then Hunter disease, there is mucopolysaccharidosis type 2, where there is similar features like hepatomegaly, coarse feces, short stature, and the disease is due to deficiency of iduronate 2 sulfatase. Then comes Krabbe's disease. And the Krabbe disease, this is a lysosomal storage disease due to GALC gene or GALC gene defect due to deficiency of galactocerebrosidase, and here is also known as globoid cell leukodystrophy. And the patient have irritability, feeding problems, muscle weakness, ataxia, spasticity, then seizures, vomiting, cognitive decline, and in the there is demyelination, which is giving this kind of symptoms. And in the MRI, you can get this kind of picture, like this is a tigroid pattern of demyelination, and brain atrophy you also can see here. Then comes very important or very interesting pictures. This one, this is Menkes disease. Then you can see kinky hair, and there is a ATP7A involvement. And then comes Niemann-Pick disease, where there is a defective sphingomyelinase enzyme action. Then Hartnup disease, the Hartnup disease due to inability of the absorption of the neutral amino acids like tryptophan. So defective tryptophan absorption will give rise to some conditions like as tryptophan is the precursor for niacin, so niacin deficiency or vitamin B3 deficiency, Cazel's necklace, as a dermatitis, diarrhea, and dementia you can see. And uh, next comes Rotheras test and Garhart test. The Rotheras test and Garhart test are used for detection of ketone bodies in urine. It's a bedside test, very important. It looks like a deep purple ring at the junction of the two fluids. Thank you.